And this is Medical Emergency. Daniel is just 24 years old. A blood vessel has burst, without warning, deep inside his brain.
All these white bits should not be there. They are blood in the brain.
Daniel's been struck down by a brain hemorrhage from a ruptured aneurysm.
You can die from it, right? From this condition, yes.
In an effort to save his life, a series of tiny coils will be inserted into Daniel's brain.
The risk is that when you're putting the coil into an aneurysm that's bled, the coil can rupture the aneurysm, that he could bleed to death on the table.
Also tonight, an Australian Olympic hopeful arrives at the Alfred after a freak accident.
Everything started crunching and cracking and popping.
Glenn's expected to make the sailing team for the Beijing Olympics. That's if doctors can get him up and about in time for a crucial qualifier.
I might become his walking on crutches coach.
Sometimes an accident can lead to a startling discovery that changes the course of a patient's life. 67-year-old Faye's most immediate problems appear to be injuries sustained in a terrible car crash.
Faye's a 67-year-old female, previous history of hypertension. She was the driver of a sedan, a Commodore, car versus pole. She was encased in the car because of active electrical cables around for about 40 minutes. Airbag was deployed, lap/seatbelt was worn. Pelvis is the issue. Query either left-sided pelvic fracture, anterior dislocation of the acetabulum, or greater trochanter fracture there.
Faye's being checked for obvious signs of internal injuries.
Pelvis X-ray. Don't move your arm.
You used to be touching your toes, Faye? Yeah. You push against my hand.
Patients here coming today. Oh, okay. We're concerned about the left side of the pelvis and the hip area because she's getting quite a lot of pain in this region, but on the X-ray they were not really finding an obvious cause for that. It doesn't look as if there's a broken bone or anything to explain her pain in that area.
How are you? Thomas Kosman is my name. I'm the director of the trauma department, looking after you. What I have heard so far, you were lucky.
Thank you.
We just do now a few checkups, and even we have at the moment no indication that you have a pelvic fracture. That's why they took it off. Now we are just checking your head and your neck.
It seems extraordinary that Faye could have survived such a serious crash with only minor injuries. But CT scans could tell another, more troubling story. In triage, a world champion sailor's been brought in after suffering an unfortunate leg injury, and the timing couldn't have been worse.
We're doing the Sail Melbourne regatta at the moment, which is actually part of our sort of Olympic selection program for Beijing.
Glenn was resting his foot in a strap on the deck when he lost concentration and slipped.
My whole body basically did a circle around my foot, which was in the one position, so everything started crunching and cracking and popping.
Glenn and his teammate Darren are meant to be competing in Europe in 5 weeks' time. It's an important trial in the lead-up to the 2008 Olympics.
So that's under my toe, when you lift there with your hand, that is absolutely agony.
More on this side or more over here, which correlates with this bruising.
Yeah, that's exactly it.
All right, well, we'll get some x-rays down this end of the foot and we'll see where we are.
As Glenn heads to X-ray, his coach Mike has arrived.
We need him in good shape so that he's ready to race in Europe and summer season over there. We've got the test event this year in China for the Olympics.
In a few minutes, Glenn will know if he's suffered a fracture. His Olympic preparations rest on the result. In an emergency bay, a 24-year-old man's being prepared for a procedure that could save his life. Daniel had been rushed to the Alfred after suffering a brain hemorrhage in his sleep last night.
He's our own